Welcome to another episode of What's the Difference podcast. I'm your host, Sarah Patel today, and Jackie Rosen is going to be speaking to us about her baby and her journey having Hannah. And we also have Samantha Moore with us. So welcome everybody.
Hey,
and
everybody.
I'm really excited to hear what Jackie has to say as a new mom.
I'm excited to share everything that's gone on with the podcast, with our podcast listeners. And as a matter of fact, you could soon be reading the written account of Hannah's birth on my blog site, which is jackierosentoronto.blogspot.com. Hannah is a month old as of tomorrow. So we're filming this on March 7th. She was born February 8th at 2:50 in the afternoon, weighing 6 pounds, 13 ounces, and measuring apparently 19.2 inches.
I know originally you were scheduled for a different day for a C-section, and she came a little bit early. So do you want to share a little bit about how that went about?
What ended up happening is that about 35 and a half weeks pregnant, I started getting the worst chronic pain I've ever had in my life. Now, I've talked before on the podcast about how I have vulvodynia and interstitial cystitis. Interstitial cystitis isn't a formal diagnosis, but I've pretty much figured out that I do have it. And so that's all pain in the pelvic region, obviously. And so, when the baby drops for any woman, it can be quite painful and quite uncomfortable. For me, that was about times 10 because of my chronic pain. So I could barely move as of about, as I got towards 36 weeks pregnant, it was getting harder and harder to move. And at one of my appointments, because by the time you're 36 weeks, you have appointments every week with the OB. And at one of the appointments, I told my OB's nurse, I'm like, I don't know how I can go on. My original C-section was scheduled for 38 weeks and 5 days pregnant. And he said, I prefer to take the babies out closer to 39 weeks if possible. But he said, but if you're really in this much pain, we can go earlier. I guess if he's putting it in my capable hands, then he thinks it's safe. So I called my husband right away. I called Dennis. I'm like, Dennis, can we have a baby on Monday? Will we be ready? And Dennis said, he giggled and he was like, I guess so. Every first trimester symptom, second trimester symptom, and third trimester symptom hit me simultaneously. I was just sick. Any doubts that I had about, is it too early to deliver her? Is it too early? Kind of just went out the window, because it was just at this point, it was like, no, I have to get this baby out. After 8.5 months being pregnant, it was just, I am done being pregnant. I am so excited to get this baby out. The only difference was that we couldn't have any visitors. And that was okay, because I was in no shape to have visitors. Even our parents at that point would have been too hard for me. I was in so much pain that I was in a lot. I had a really, really bad phase, period with my mental health that was really bad after she was born. The actual C-section experience, for anyone who has not had one, it's kind of terrifying. And this is coming from someone who's had 3 heart operations and 2 minor stomach operations. It wasn't so much that it was painful. It was kind of freaky and terrifying. So I felt the moment she was taken from my body, I felt it so strongly. It was scary as all hell. It was the most traumatic and most beautiful moment of my entire life. A lot of people, when they imagine their child being born, especially their first child, they imagine this amazing scene with their partner, and you're embracing and you're tearful and you kiss your baby on your head and all that. And it was nothing at all like that. It was more of, they took her out. I was screaming, having a panic attack. Dennis was trying to calm me down on one side. The anesthetist was on the other side trying to calm me down. I was shaking and so fearful. And you do shake after a C-section, but I was shaking, I think, at that point out of fear. So much for my imagined moment with this beautiful, first meeting of your baby. It did not happen like that at all.
You just don't know when even if you have planned a vaginal, delivery or a normal delivery, you just don't know what can happen at the last minute, right?
people don't have babies at home anymore. So nobody really sees, unless you were like close with a sister or sibling or something, like you don't really see a birth.
So what ended up happening with Hannah was that the suctioning did not get everything out of her lungs, or did not at least, help. It didn't cure the situation. So when they wheeled me back into recovery, they put her on my chest for like 5 minutes. She wasn't breathing properly. Suddenly my mind is going to my own birth, because not that I remember my own birth, but I've heard it many times from my own parents who, with me, it was, I wasn't breathing properly in my first couple hours, and my parents kept telling the doctors there's something wrong, and they kept suctioning me, and it wasn't getting better. And then 4 hours after I was born, I was diagnosed with tetralogy of Fallot with absent pulmonary valve, which is my congenital heart defect. Obviously, my mind is going to this. When I see my daughter's not breathing properly, my mind is going to, oh my God, history is repeating itself. So I'm freaking out, and I'm going, they're going to send her to the NICU. It's going to be a repeat. And then sure enough, after about an hour, a pediatrician comes in and says, we have to take her to the NICU. At this point, the medication that starts to erase your memory was starting to kick in. So I'm not totally with it right now. So my memory is starting to go. I'm starting to lose like actual, I can't remember much anymore from this point onwards, but I just remember them saying that they had to take her. And I think the hardest thing for me was not only, the fact that I only saw my daughter for 5 minutes the day she was born, but that what happened to her was eerily similar. And it even said that like, this is normal and that your baby will be fine in a week. But I still was latching on to the, oh my God, what if it's not that? What if it's something else? What if history is repeating itself? The good news is that she did really well once they took her to the NICU. They even put her in a room that they said was only for babies that were going to be returned to their parents very shortly. That was great. I mean, the next day I went to the NICU and saw her 3 times, but I wasn't in shape to go for long periods because I could barely move.
Do you think, Jackie, that I guess that's the interesting part of having a kid, is that like you almost see parts of yourself and your partner grow up? And do you think there's going to be more triggers for you, obviously, as she gets older, like that might be perfectly fine, but because of like, your reality and stuff that you've dealt with, like you're going to be like, oh my God, this is happening, like history is repeating itself. How do you think you're going to handle some of those going forward?
That's actually an amazing question. And so that's been the most difficult thing for me, is the, oh my God, I keep preparing for the worst, even though nothing's bad is happening. So when I was 19 weeks pregnant, we had a fetal echo to determine if Hannah had a heart condition. And it showed that she did not have any heart condition that was, first of all, inherited from me. And she looked like if she had any heart condition, it would be something that would be fixable upon her birth. So as it turns out, her heart is fine and strong. However, I have been triggered so much in the past 3 weeks, or the past 4 weeks now since she's been born. And this is going to keep repeating itself. I am working with a psychotherapist. I think I had major baby blues at first, compounded with the triggers from my own past, and everything was mixing up. And it was a very, very difficult, I guess the first 3 weeks, 3.5 weeks were very, very difficult for me. And Sam, you're right. I am going to probably see triggers going forward. It is something I have to work on with my therapist. It is something that I'm going to have to tell myself, this is now, that was then. There's so much that's different for women with chronic illness who are trying to get pregnant, or who are pregnant, or who are postpartum. And I think that it's still because women like me back in the day just didn't get pregnant. They didn't have babies. Or, in some cases, women with disabilities were sterilized. They were told you can't have babies. We're medically making sure that you can't have babies. And so it's still a relatively new thing. She's about to get ready for a feeding.
So exciting.
There she is. So everybody, this is Hannah. Say hi, Hannah.
Hannah.
Hi. Say hi.
Hi,
She
Hannah.
looks a little drunk right now.
So precious.
Maybe she needs to sleep. She needs to sleep. Yeah. And oh, yes. And Hannah spit up on mommy at least 3 times before we started taping. So the funny thing is that I said to Dennis, I'm like, if this had started, if I was actually had Hannah and then got pregnant again, I can't even imagine how hard it would be to clean up spit up. You know, like with pregnancy nausea, it would be so hard because I can barely stomach it now and I'm not nauseous anymore. So there you go. Say hi to everybody. Say hi. Pull my hair. That's right. Pull my hair. Pull my hair. Okay, back to daddy now. Back to daddy. So that is Hannah. She is hopefully over 7 pounds now. We'll find out this week. And she's the new little person that keeps me very busy.